I'd like you to take a moment to think about how important your senses and movements are to your daily routines. Now think about how different your life would be if you became paralyzed. I know someone personally who's experienced this life change, and I've been researching a major cause of it. I want to tell you today about a hemorrhagic stroke. I'd like to inform you of the causes and symptoms, treatment and complications, and a family member of mine who survived it. According to AANS.org, a stroke is the third leading cause of death in the United States, and there are about 700,000 strokes each year. A variety of causes and symptoms exist depending on the type of stroke. There are two types of strokes, ischemic and hemorrhagic. About.com states that 87% of strokes are ischemic, while only 13% are hemorrhagic. MayoClinic.com gives the difference between the two. Ischemic strokes are whenever an artery in your brain becomes blocked, causing reduced blood flow and reduced oxygen. Hemorrhagic stroke is when there's a tear in the artery's wall and a blood vessel bursts, causing bleeding in the brain. Health.com states that hemorrhagic strokes are less common, but they're far more deadly. According to Heart.org, the most common hemorrhagic stroke is an intracerebral hemorrhage. This is when a blood vessel bleeds into the brain tissue. Subarachnoid hemorrhage is when an aneurysm, which is a blood-filled pouch protruding from an artery, bursts and there's bleeding between the brain and the skull. Different factors and symptoms can lead to a hemorrhagic stroke. Controllable factors are things like smoking, blood pressure, carotid artery disease, diabetes, high cholesterol. And uncontrollable factors are things like gender, like it's more common in males, age, heredity, and then if you've had a previous stroke. Warning signs can vary depending on which arteries of the brain are affected. Symptoms are nausea, severe headache, confusion, numbness on one side of the body, abnormal speech, difficulty of comprehension, loss of vision, and coordination. The severity of a stroke affects the treatment and outcomes. A hemorrhagic stroke should receive immediate medical care. Medical care is usually given in the ICU of the hospital and involves multiple tests and medications. Tests are crucial in finding out the treatment. A CT scan determines the brain hemorrhage, and then an MRI shows the cause of the bleeding. Other tests include a complete blood count and a CSF exam, which is cerebrospinal fluid exam. Multiple medications can be given to control the blood pressure and swelling in the brain, such as antihypertensive medications, anti-anxiety, hyperosmotic, and anti-seizure medications. Surgery may be needed for recovery, especially if there's aneurysms and AVMs. A craniotomy can be given, which is when they make an opening in the skull bone, or a catheter can be threaded to the aneurysm. Long-term treatment is physical therapy, occupational therapy, speech therapy. There are multiple effects and medical complications of a stroke. UpToDate.com states that complications can include blood clots, difficulty eating and drinking, heart attack, urinary tract infections, decreased social interaction, and decreased functional abilities. The effects of the stroke depend on the location of the brain tissue obstructed. One side of the brain controls the opposite side of the body. If you have a stroke on the right side, there can be paralysis on the left side, vision problems, memory loss, and purposeless behavior. A stroke on the left side can result in paralysis on the right side, speech and language problem, slow behavior, and memory loss. Learning about a stroke has helped me to better understand what my family member has went through. My grandmother suffered an intracerebral hemorrhage 8 years ago in February of 2004. She was 70 years old when she experienced this stroke, and she was having several years of uncontrolled high blood pressure. The stroke took place in her home while my grandfather was outside, and she actually, her symptoms were a severe headache, vomiting. She got sudden numbness on the left side of her body, especially in her arm. She was able to pick up the phone and call her neighbor, who then called 911. The paramedics brought her to the hospital, and she had to be monitored due to constant swelling and bleeding in the brain. She almost died from the blood filling her brain. The blood vessel burst on the right side of her brain, which resulted in the left side of her body being paralyzed. She was in the hospital for 1 month, and then another month for an outpatient skilled nursing facility. She received physical therapy and occupational therapy for a year and has little movement in her left side, but still remains in a wheelchair. Besides uncontrolled blood pressure, this may also have been due to genetics. High blood pressure is really prevalent in her family, and then her mother, her mother's brother, and her mother's father also had a stroke. In conclusion, a hemorrhagic stroke can occur for multiple reasons and requires immediate medical attention. Treatments can vary due to the type of stroke and the seriousness. Certain complications can change the rest of a person's life. I'm thankful for her to still be alive, and if she hadn't received help immediately, she might not still be here today. It's important to appreciate every day of life because you never know if one day your entire life will change.